Namaskar. Welcome to Know Me by Dr. Aditya. Here in my show, I have with me a psychological counselor, a psychotherapist, a certified parenting coach, a career strategist, a DMIT certified practitioner, and a renowned author. She has recently released this book, which says all about shared future, crafting a strong foundation. What inspired you to choose this career and being a psychological counselor, psychotherapist? What inspired you to be?
When I was in my first degree,
Mm.
so we had a subject called organizational behavior.
Mhm.
So the word behavior fascinated me.
Okay, so the word behavior is what inspired you actually.
Yes, yes.
Uh, in psychology, what according to the psychological books, what I may say, who is a teenager, who is a mid schooler or a toddler? While going through my research, I realized that there are like three brackets you have actually they have divided.
Toddlers will be from 0 to 5.
Mhm.
Like 0 to 1, they call as infancy. Till 5 is toddlers. From 6 to 12, they are called mid schoolers. And from 13 to 19, they are teenagers.
Just teenagers. What are the most common psychological issues you have come with patients or students or children coming to you?
Generally, there are like anxieties, depression, and ADHD, mood disorders, eating disorders. All these are the psychological issues which nowadays our children, yeah, teenagers are facing. So first, we are talking about need. Once a need is not fulfilled, only once the need is not fulfilled, they come into under psychological issues. How it works? Needs are according to Maslow's need theory.
Mhm.
Maslow has given five needs like physiological needs, safety needs, love and belongings needs, esteem needs, and self actualization needs. In this present generation, when our children are exposed to screen time, gadgets, and all these present generation, we come across three more needs, that is, fun need, freedom need, and power need.
So you trying to say that these needs, when they are not fulfilled,
Yes.
people tend to be psychologically
Yeah.
affected and get
Yes.
okay.
Yeah. Because there are different emotions. Emotions like when we see a object, when we perceive that thoughts what we get might be rational thoughts, might be rational thoughts. So when we get a rational thought, our emotions is happiness. So obviously we are happy, we get expressed, we get it as a smile. Secondly, when it is irrational thoughts, automatically our feelings will be sad. Yeah, it will be guilt, shame, anger. So when we have these emotions, automatically our behavior changes.
Okay. So, talking about just the basic thing, when we see a psychologist or during my research, I realized that there were like three different words very commonly used. That is ASD, anxiety, stress, and depression. If one has to differentiate, a child is suffering from either anxiety or depression or stress. What are the common things physiologically, or how would anyone differentiate between ASD?
First, we'll talk on depression.
Hmm.
So, depression is sadness. One word we can say as a sadness. And disappointments in life, struggles in life make a person sad. So, we can say depression is sad. Here, the psychological issues will be an individual might feel that I am not happy, a feeling of helplessness, a feeling of hopelessness, and suicidal attempt, self harm. All these comes into their mind when they are into depression.
Okay. And what about
Because
anxiety?
yeah, anxiety is, we can say anxiety is anticipation. Anticipation in the sense worry about the future.
Okay.
So if the threat, if the severity is more, then it is called as fear. If the
Okay.
threat intensity is less, then it is called as worry.
And what is then stress?
So, stress is what we are seeing in front of us. Like, what I mean to say is, depression can be a past one, anxiety can be a future, but stress is a present
Presently.
one. So when we have to work on stress area, so
Hmm.
that slowly these two will reduce their intensity. We cannot completely bring it down, but slowly we can reduce the intensity of anxiety as well as a depression if you're working on stress area.
So as everyone says, live in present, forget the future,
Yes,
and
right.
don't worry about the past.
Past.
So how do you approach with students or with kids or teenagers who have difficulty in expressing their feelings? What is your go-to method of approaching them and taking them out and trying to know their what's going on with them and why is all this thing happening, especially to kids those who are very difficult in expressing their feelings?
When a client come to me, might we'll take a teenager.
ठीक है.
Yeah, I make them comfortable. First is comfortable. I work I work with CBT, that is cognitive behavioral therapy.
Okay.
That is called as a talk therapy. So here I use UPR as a counseling grade. UPR.
No, excuse me, but do you meet them in person or या फिर or with parents? मतलब parents भी आते हैं साथ में? You
Yes.
want them? You want the parents to come along?
Yes, yes. Initially, I call parents and I talk to them.
Hmm.
It depends on the child. If it's okay with the child, if it is relating study areas, I can talk to them.
Hmm.
But when I talk to a child, I feel like I should guide the parents. So I ask parents to come in and I talk to them. And I talk to parents separately. Again, I talk to child separately. I put three of them together. I talk to them and then try to solve the thing.
So how do you make them express when
Yes.
somebody is like
Yes.
not very expressive?
Yeah, I use UPR, that is unconditional positive regard. That means accepting everyone as same. And I identify their personality. So it is thinking, feeling, reactive, and inactive modes. So again, I ask them, I see their posture, the content, gesture, tone, and when I talk to them, I'll come to know whether the child is in feeling mode, whether a teenager is in a thinking mode. So on that basis, I ask them. Yeah,
Approach.
I approach. In content, they might say like, "I'm sad."
Hmm.
From the content, I'll come to know like what might be going on in the child.
Content as if in like the words they use.
Yes, the words they use. Sometimes they say, if we are talking about some, if you're going for with the teenagers, they might come with different things. I have friendship, all these things. So I can use, they use some words, that love words, I hate, I don't like somebody, and I don't like this situation. I'm very much scared to go into that situation. That these are the contents what they use, and posture, the way they, the expression, facial expression, eye contact is very important. I say that eye contact and the way they sit, they the changes in their body language also matters a lot. So on the basis of all these things, I talk to them.
Okay.
Yeah.
So once kids are open, the teenagers are open. Uh, we have been discussing about anxiety, stress. Uh, let's go one by one on anxiety. How do you deal with social anxiety? And what do you do? Or do you tell a client or a client is a wrong word. How do you deal with social anxiety? Patient with a social anxiety,
Yeah.
like fear of judgment.
Fear of judgment is like, if it is a teenager or a student, I just guide their parents. I call them and I guide them. Because first thing is I talk to the child and get to know like which situation child is facing this.
Mhm.
So I ask the parents to come in and I talk to them saying that you have to involve the child with you always. Because what we do when a child is 1 to 5, that toddlers, we cuddle our child, we pamper our child. But when they grow up, when they are in 8, 9, 10, and 11, when they are teens, we think that they are independent. अपना वो लोग करेंगे. So here what happens is the child needs more attention.
Okay.
Yeah. So when you take them with you everywhere, ask them, sit with them, talk to them, like you should know their views. Any matter it's happened in the newspaper, might be somewhere in any of the schools, any of the colleges. Just sit with the child and ask like हमने कल पेपर में पढ़ा था बुलिंग के बारे में तुम्हारा क्या इसके बारे में तुम बोलो तुम्हारा माइंड में क्या चल रहा है तुम
Okay.
उसके लिए कुछ बोलो then you will come to know that your child what view child as in that area. And also you have to share your routine with the child. When you're sharing your routine with the child, automatically the child will share its routine. Anything, any problem, any anxiety, it will come with the things. Child will say it will say to the parents like, yes, this is a thing, like this is happening in my life. So the parent should be approachable for the child, so that it will child will express each and everything, might be good or bad, might be happy or sad. Now the parents will know the child. Once they know the child, once they are with the as a friendly, with the child, not as a friend, as a friendly. Okay, well, friendly and friend. I mean, yes, you are saying that parents should never be as friends. They should only should be friendly. Yes. Could you just elaborate it, yes, please? Friend is like it is showing sympathy. Okay. Friendly is showing empathy. Examples of बताइए please. If a person goes to a friend and says that today I have this problem, my mother shouted on me, my father shouted on me, or else breakups have all these things. So they go to their friend and say like, so the friend will say, यही होता है सबके घर में, तुम्हारा घर में थोड़ी चेंजेस है, यही होता है टीनेजर में, ये सबके घर में होता है ना, like this is just sympathy. But when you go to your parent and you express, like they know your feeling, they know the pain of yourself, they will be like show their empathy, showing that yeah, this is a thing, okay, we'll sort it out. You come up with the things, anything, any problem you're having, come and talk to us. We both will sit calmly and yeah, communicate. We have to connect with the child. Communicating, open communication is very important with the child. What advice do you give to people who have fear in public speaking? The problem is this generation, when they are into the social media, most of the children, they read, understand only from the gadgets, from the screen. They doesn't have much contact with the people. Mhm. So here the problem is difficulty in communication. So public speaking is where again the problem is they have to face the audience. In a public speaking, there are three components: one is listener, one is speaker, and the situation. So they have to choose a topic according to the situation. Mhm. So they let them take a topic and they have to prepare at least 30 to 40 points on the particular topic. And they have to practice it. They have to keep audience as parents, two audience, then your friends, then you have to increase the numbers. So slowly they'll come up with those public speaking fright, stage fright, what we call as, and gradually they will be. Okay. In my research, I was going through this word called FOMO, fear of missing out. How do you deal with the patients who come with fear of missing out with their body shame or like with lifestyle imaging? How do you deal with the fear of missing out? Fear of missing out is like they think that yeah, see, they are enjoying. So I cannot do this. वो मौका मेरे को नहीं मिला. Opportunity जो भी है. Then these are the things where they think that I cannot do that. Why I cannot do that? My friends are enjoying. They should have some self control on them. They should just come out of that social media, a little bit of self control on them, and they have to work on themselves. Only then they can come out of this FOMO. Okay. In this present age, बहुत सारी जगह ऐसा होता है कि there are students or there are friends who are exposed to unrealistic comparisons. Like you are wearing a Gucci shirt,
I'm not wearing a Gucci shirt. I'm wearing Prada. You're wearing Balenciaga. I'm wearing this. So, and there is someone who does wear something lifestyle, and there are like images, and there is say, success related. Somebody has scored real good marks. Somebody couldn't score marks. Somebody did this. Somebody couldn't do that. The patients who are exposed to unrealistic comparisons.
Comparing yourself with others. This
Ha.
is this is one. So what we have to tell them is they have to work on their strengths and weaknesses here. No need to compare with them. Here, parents' role plays a lot. They should not discuss about their wealth to the child.
Okay.
Positions, what we call as. So when we call the position, these students, like children, what they do, teenagers also we can say, some have that thinking that I have everything, my dad has kept well. When the child is teenage, normally parents will be about 40 plus. So they are busy in making wealth for the future of their children. Yeah. So here they forget their children to give
Mm.
as a companion. They won't talk to the child. So child think that every facility is given. So every facility is given. Child doesn't know the hardships of life. So here, when it is with mingling with the other people, other students, generally it makes a comparison. Children do the comparison.
So your advice is that parents should not disclose their wealth and should not give them.
More facilities. When facility is given, children doesn't know the hardship. So when they go and mingle with the other children, they might come up with these things comparing. So what happens is the children who cannot afford, so they have problem. They come up with certain
But
things.
what about body imaging and success and how? See, if somebody is, एक example देता हूँ मैं जैसे there is a student who has scored very good marks and this student who is haven't scored good marks. So there is a comparison. How? What do you say to parents or to students like that?
I always tell them like as a student, their thing is they have to study. It's not like that one is studying, other one cannot study. So what I do is whenever they come to me, I help them in the way they have to sit and study, how to make a routine for studies. So obviously they can do it. It's not like that nobody can do it, but they now they are deviated into social media, so everybody are into gadgets, so it doesn't give time for this thing. And one word we spoke, procrastination.
Mhm.
So procrastination is they are escaping, like they are prolonging, they are postponing the things. Children are postponing because they doesn't want to sit and study, they doesn't want to give time for this slow activities, they are into speed activity.
So what advice do you give to students who suffer failure or they have a fear of failure?
Here again the parents role come in. From the initial ages, they start sharing. When they come with some failures, they can approach the parents. Parents can tell them it's okay, this failure happens, you have to accept, we'll work on that.
So somebody if a parent has a real high expectation, I'm मेरा बेटा तो पायलट ही बनेगा, मेरा बेटा तो साइंटिस्ट ही बनेगा. So
Yeah,
what advice ki आप see everybody is not equal.
right. Again, the parents and the child should sit together and they should ask a child's goal. What is your goal?
Hmm.
So when the child is standard 9, 10, we should set a goal for them in standard 9 itself. Because nowadays this generation there are different careers. There are specific careers, neutral careers, there are new age careers. So children during teenagers they are confused with everything nowadays. And parents they think that मैथ्स अच्छा करेगा तो मैथ्स में अच्छा है तो वो इंजीनियरिंग बनेगा,
Okay.
बायो में अच्छा है तो मेडिकल में जाएगा.
Okay.
So here both will sit, parents and the child. They have to sit together and know there is one psychometric test. So if psychometric test is done, it helps about to know child's aptitude. There are some aptitude questions and some personality questions. So what happens from that psychometric test will come to know which area the child is better, and we'll come to know some industries also, which area a child, this student, this teenager can go further. So on the basis of that, counseling will be done on the basis of that, and they can choose a right choice. It from the aptitude and the personality test, it shows that the child is good in which area it can move in.
Tell me how to deal with students who are distracted with gadgets, addicted to gaming, Facebook, Twitter, Reels. How do you help them?
Teenagers are like, they are victims of hormones. Their intelligence is hijacked by the hormones.
Acha.
So what happens here is they respect their ideas. So here we have to keep some firm and flexible rules for them. Firm rule in the sense, 13-year-old child might ask for a bike, to ride a bike.
ठीक है.
So we are not supposed to allow the child. So it's a firm rule, we have to say no. Both the parents should speak the same language, that is common language, that is yes or no. If papa says yes and mama says wait, papa से पूछ के हम बताएंगे, so there is a difference. So बच्चा भी when it grows up, it has a confusion in dealing. So whenever a rule is made, both the parents should use the same common language, that is yes or no.
But what if the kid is aggressive?
Yeah, we have to sit with the child. We have to. That's what that communication should be done. This is your age, that we cannot give it to you, and say the consequences of that.
But what if the kid is distracted? Distracted in a sense कि उसके दोस्तों के पास है.
Yeah.
एक एग्जाम्पल के लिए कि मेरे फ्रेंड के पास बाइक है या स्कूटर है या कार है XYZ. Why can't you get me when we can afford it? Why can't you give me?
That's what we have to tell them, the consequences. Really, and we have to give some examples. वहाँ पे ये हुआ था, आपको पता है ना, ये एज में नहीं बाइक चलाना है. But we have to convince them as an open communication. We have to convince them.
But मान लीजिए बच्चा नहीं मान रहा है. एक एग्जाम्पल के लिए लेते हैं कि he is very stubborn.
Yeah.
Very stubborn, very influenced.
Yes.
With friends.
Yes. You need to divert the child into different area. Now the child is asking for some, as we spoke,
एक कार मांग ली या स्कूटर मांग लिया.
हाँ, तो बच्चों को हम डाइवर्ट करना है, वो जो वही वाला जो फन, so because of that they get fun, thrill मिलेगा. So divert that into different area, कहाँ पे productive thing है.
What is cyber grooming and cyber bullying?
Like somebody messages to a child, anybody who is with the phone, like hi, then again from this side the child doesn't know who is there on the other side. It says hi, hello, then where are you, how are you, then they will ask to send some pictures, then messages about family information. So everything is gone. That is cyber grooming. Grooming means like such a beautifully they are framing the question so that the who is this side doesn't know that who is there on the other side.
Okay.
So that is cyber grooming. Using these pictures, whatever is given, whatever is shared, whatever the information is shared, they can use it as a grooming. They can use those pictures, use those framed sentences anywhere as a cyberbullying. It might affect the child.
So your advice is कि we should be very cautious. One should be very cautious about what to send on net.
Yes, we have to guide a child, like everything, whatever is online, whatever the message is in online, it is traceable, it is visible, it is permanent, and it is recorded. So any time, if it is required, it can be traced. Okay. And this, a small mistake in this age, in teens, it might haunt them when they are adults.
So what according to you is the role of a family in child's mental health?
First and foremost is we have to pamper them, cuddle them. Though they are teens, we have to cuddle them. Secondly, we have to have open communication where we have to share our routine with them so that they will share their routine with us. So that the interaction builds up. Bonding. You can call it as a bonding.
Communication and bonding is what you're advising.
Yes. So we have to be a companion with them. As a companion, we have to talk to them. Whatever the program they are watching, we have to sit with them and watch. When we are watching their program, automatically when we are watching something, they'll come and join us. We have to reignite our hobbies. Once, yes,
Go ahead, go ahead.
once a marriage happens, generally a lady is very much into the house responsibility. So she forgets all her things, hobbies. And even a man, he is busy with this responsibility. Even he forgets all his hobbies. So now our child doesn't know like what we used to play earlier. What was parents' hobbies? So when you come with that, sit with the child, play some indoor games with the child, and play some puzzles with them. So what happens? There will be a connection, connectedness between the child and the parents. You can take them out as a teenager. You can go with them outdoor games like badminton, whatever the game is. As a parent, we have to give them time. Only then they will be as they will share each and everything, whatever is disturbing them, or else whatever is happening in their life.
How do you deal with kids who are having separated parents? Like they're going through a difficult time. I won't like to use the word, but what advice do you give to kids? क्या
Kids,
क्या बोलते हो आप बेसिकली कि बच्चों को क्या करना चाहिए ऐसे कि पेरेंट्स की लाइफ में तो कुछ इश्यूज है.
yes, more than advising kid, we have to advise a parent. A single parent has to accept that situation in his or her life. And what I suggest is they have to go for a professional help, seek professional help, so that they have to make their mindset in a very cool and calm way. Only then they can deal with the child. Because understanding a child will not understand this. So child will be going into different those traumas, like what happened. All these traumas will be there with the child. But still, as a parent being now the parent knows that this is my child, I'm with him, and nobody are there. So the mother, as a single parent, they have to take a professional help so that they can understand the child, what's
So
going on in
what
child's
advice
mind.
would you give to a child who is going through all this?
In that present situation, they say, "Okay, I'll take it." But when you call them for the second time, you will have the same mindset. They won't change. So here the main thing is you have to inform the parent. Parent should guide them. So as a student, अच्छा ध्यान देना है studies में. अच्छा सा ध्यान दे के स्टडीज करो तो तुम्हारा स्पोर्ट्स में इन्वॉल्व हो जाओ. सो यू बी बिजी विथ योर थिंग्स. पेरेंट्स उनका जिम्मेदारी है, वो देख लेंगे रिस्पॉन्सिबिलिटी, दे विल टेक केयर ऑफ देमसेल्फ. आपको क्या करना है? अच्छे से पढ़ना है, खेलना है, आराम से फ्रेंड्स के साथ रहना है. तो आप अपना लाइफ
Focus on your career.
फोकस ऑन. आई वुड लाइक टू say a phrase said by Benjamin Franklin. He says, an ounce of prevention is worth a pound of cure. That means stop something from happening before it causes damage.